Hello friends. Now today we will be discussing about the blood culture. Blood culture is an most important diagnostic method for diagnosis of bloodstream infection. It also leads us to know the secondary cause of the sepsis. So before going into it, I will discuss about that bacteremia, the presence of bacteria in the blood is known as the bacteremia. It is of three types, that is transient, intermittent and persistent or continuous. When we talk about the transient one, the transient bacteremia can occur due to several daily procedures like if we go for brushing, there the mild abrasion occurs and the bacteria, normal flora that is present in our body, in our mouth, that will go inside the blood and that will lead to the transient bacteremia. There are the other conditions that will also lead to the transient bacteremia, that is any procedure that invade or abrade the mucosal membrane. Suppose you are putting a catheter. If there is a bacteria that will enter into the blood, if you are doing any procedure like colonoscopy, endoscopy, then in that procedure also there will be abrasion on the mucous membrane and bacteria will enter inside the blood. So you should understood that normally this type of transient bacteremia actually get cleared without doing any harm of the body. They usually get cleared by the body immune defense mechanism and they are usually cleared, so there is no any further issue. But sometimes why I am saying this, because this was mentioned in the literature that transient bacteremia that occurs is usually cleared by the immune system. But practically, when I have seen a patient who has undergone, she was a young girl but liver transplant patient, and she was undergone colonoscopy as she was liver transplanted and had immunosuppressant and undergone colonoscopy. The next day she started to have fever. She was fine perfectly, came outdoor procedure, but when she undergone the procedure, next day she developed fever, and after that we have to draw the blood culture. After blood culture there was a growth of enterococcus. So it's clearly mentioned that sometimes, mainly in the immunocompromised patient, even transient bacteremia due to any procedure can also lead to the bloodstream infection, even sepsis. So that is need to be considered, but usually transient bacteremia are cleared by the normal immune defense mechanism. If you are not on immunosuppression or immunosuppression, any disease is not present. Okay, it's only to be considered when their immunosuppression is there due to any reason. Second is intermittent bacteremia. Intermittent bacteremia means that the bacteria is released into the blood intermittently, that it is not continuously present in your blood. Suppose there is an abscess anywhere in the body. From abscess, the bacteria is released intermittently. So in bloodstream, they will not be present at continuous time. Even in pneumonia, there will be a intermittent bacteremia. Mainly abscess and bone infection. Is these two conditions will find that bacteria present in the blood are intermittent. The most common, if you remember, that will be the abscess. That will be responsible for intermittent bacteremia. Since abscess, we are not in abscesses, we have to obtain the organism by draining the treatment of abscess is to first treatment is source control. You have to drain the abscess. Then only antibiotic is going to work. In abscess, if you are going to cure only with antibiotic without proper source control, without draining, it will not going to work. So in that case scenario, you drain the abscess and you culture that fluid and you obtain the organism and manage accordingly. So in intermittent bacteremia, there may be fever, but we may miss into the blood culture. That is my point on it. Okay. Now come to the continuous or persistent bacteremia, that is bloodstream infection due to any cause. That may be a central line infection, peripheral, any line related infection, infective endocarditis, or other conditions like typhoid fever, that is enteric fever, brucellosis, other conditions there will be a persistent bacteremia. In that situation, what we need to do is take the blood culture, and the blood culture obtaining is not related to the fever, not related to the timing. It's only related to the amount of, that is volume of blood that we take. The more volume of blood we take, more there will be a chance to grow that organism, more there will be a chance to get that blood culture positive. So always remember, it's only depend upon the volume that we have obtained, because the amount of bacteria present is very small per ml. So the more the volume of blood we get, the more the bacteria will get into your blood culture, and more the bacteria will be get into the blood culture, the chance of detection will be more. Okay. So, and one more thing is that when we take the blood volume, there is dilution of that blood volume with the broth, and it is usually 1:9. So if we are taking any bottle, okay, if you are taking any bottle and that contain, suppose if you are taking manually, usually here manually, Nepal most of the laboratory done manually. So in that case, you will obtain a 45 ml of broth. This is BSI broth, brain heart infusion broth. In that broth, you have to add at least 5 ml. The more volume added, the more is better, but at least 5 ml. So 1:9 ratio. Okay, 1% is the blood and 9% is the broth. This is usually done in our laboratory. But you have to remember one more thing is that this dilution is necessary because there are a lot of advantages. One, that will the dilution of your inhibitory component into the blood, in your blood. There are a lot of inhibitory component, likewise there is a complement, there are other antibiotics may be present, any other inhibitory substance will be present, that usually get diluted in this broth. And so that since it is diluted, now the amount of bacteria that has come in your blood will not be inhibited due to the dilution of that inhibitory component, and it will get more nutrients to grow. So the American Society of Microbiology, ASM, recommend that it should be 1:9 dilution. Okay, when we are coming to a bacterial or bacterial blood culture bottle, there at least 10 ml of blood is usually required. So we will give in this bottle at least 10 ml, at least. Okay. So we have now, since I was talking about the sets of blood culture, how we will withdraw that blood culture, that will I discuss just a little bit later. One thing that you have to remember, that for endocarditis and detection of sensitivity in non-endocarditis patient. Okay, in endocarditis, if there is a endocarditis present, then there are the two recommendations. One from the American Heart Association. One is recommendation from American Heart Association and European Society of Cardiology. They recommend that you have to take 3 sets of blood culture, and that should be 0, 1. That should be 3 sets of blood culture. That is 1, 2, and 3. Each set includes one aerobic bottle and one anaerobic bottle. So you are taking 3 sets of blood culture. That is 1 for aerobic, 1 for anaerobic, and they should be taken within 1 hour. So at least they say that at least first and last should be 1 hour gap. So if you have taken at 0 minute, you consider the first at 0 minute, then last as of 1 hour, then second you take at 30 minutes. So half hour interval you can take 3 sets of blood culture, and one set is one for aerobic and one for anaerobic. That you have to consider. Okay, there was another guideline from the British Society of Antimicrobial Chemotherapy. They said that there are two conditions. If you are thinking that it is acute infective endocarditis, then take 2 sets of blood culture within 1 hour. But if you are thinking that it is subacute or chronic infective endocarditis, then in that situation you can take 3 sets, that is to be taken 6 greater than equal to 6 hours apart in 24 hours. So it does mean nothing. Initially, as we used to take in within 1 hour 3 sets, now we have to take within 24 hours 3 sets, and that will be 1 set. The gap in one, first suppose you are taking 0 hour, then you take at 6 or 7 hour or 8 hour. Okay, then you take at 16 or 17 hour. So the most important thing, you take suppose 24 hours, there are 8 3s are 24. So you take 0, 8 hours and 16 hours later. Okay, so within 24 hours you have to take 3 sets of blood culture. Okay, now how to obtain that blood culture? That is very much important of this video or this lecture. The important is that, as we know, the blood culture are obtained by nursing staff, and they should be clearly instructed that how to obtain the blood culture. That is very much important. Okay, so what to do? I have told about that. Okay, let me explain you one more thing here, that the more the amount of blood, suppose you have taken 1 set, the sensitivity of 1 set blood culture is to obtain the organism will be 65.1%. But when we take 2 sets of blood culture, then the chance sensitivity of obtaining the organism, growing the organism, will increase to 80.4%. And when we take 3 sets of blood culture, then it increases to 95.7%. So always remember, if patients are critically ill or anywhere, if you are trying to obtain a blood culture, then always do prefer 3 sets. You are taking how much ml? You are taking 1 for 30, 60 ml. In human being there are 5 to 6 liter of blood. So you say 5000 ml. You are just taking 60 ml. It is not going to hamper anything. When you are giving 1 pint around 460 ml of blood, then it increases 1 gram of hemoglobin. So if you are taking 400 ml of blood also, then there will be a chance of just decrease of 1 gram of hemoglobin, and you are supplementing a lot of fluids, so the volume will not be much affected. Some patients, usually in practical guideline, when the people are uneducated or patients relatives ask, they always tell you have taken a lot of blood from the patient is already dying. You will convince them that the taking blood is not going to hamper him or her. You are not going to take lots of blood. Okay, but if we are getting more blood and we can diagnose what is present, the blood culture positive means make a lot of differences. If you have a negative culture, then you are treating everything empirical. But if you have a grown culture positive and DST, then you can save the patient. You have the drug sensitivity, you have the organism, you can save the patient. So that matters, actually matters. So we are explaining this, that you should always prefer to take more sets of blood culture. That is the main point, the main message here, that more the blood you take, more sets of the blood culture you say, more will be the chance, and we have to send at least 3 sets to get 95.7% sensitivity. Okay, so you always remember that there is no point sending one bottle of blood culture or 2 bottles of blood culture. You are getting just 65%. So you are missing this 35% chance. That you have to remember. There is no point of taking half diagnosis. If you have sent blood culture, you have sent 2 sets of blood. Suppose 1 set of blood culture. Now we have missed the diagnosis. He or she is infected. He or she is in sepsis. But she belongs to the 35% and your blood culture is not positive. Now what is the sense of that? It is actually harming you. It is actually telling you that, okay, nothing is going from the blood culture, now what to treat? Now your treatment, you are nowhere. You are operating in empirical only. So sending less blood culture is actually harming the patient. That is the clear message to you. Okay. Now obtaining blood culture, for blood culture you should obtain from the peripheral percutaneous puncture normally. If there is central line, then you take from central line also. But important thing is that you have to how to obtain it. Normally you have to do is first you apply the alcohol. 70% alcohol is enough. You apply alcohol. That will remove the dot and any dot is present in over the skin. Okay. You apply second time. First time you apply 75% alcohol, you swab it. Okay. Then there will be a second time you again apply with alcohol. What that will do is that will remove the fat present over the skin. Okay. The defattigation will be occur. First, dot and other material will be removed. Second, defattigation will be removed. Then make it dry. It will dry in a few seconds. Then apply betadine. Okay. Apply the betadine and wait for 1 minute. Just apply and remove. His prick is not done. First apply alcohol, let it dry. Second apply alcohol, let it dry. Then apply betadine. Okay. Let it 1 minute to do the action. This betadine will make action and kills the normal flora present on the skin surface. Although alcohol will also kill the normal flora, but for complete sterilization, you have to apply the betadine. Otherwise, your normal flora will present in skin and that will grow in blood culture. So your blood culture will be false positive. You are trying to get the organism that is present in the blood, but you are growing the organism that is present in the skin. So this is very bad news. This is vast difference. Treating the actual organism that is causing infection is important. If you are treating the organism present, normal flora present on the skin, then patient is going to die. The actual culprit is not going to be treated. So there is no point of that. Okay. First apply alcohol, let it dry. Separate second alcohol swab, let it dry. Apply betadine, wait for 1 minute. Okay. And then clear that betadine with alcohol, because sometimes some patient may have betadine allergy. So you clear that betadine with alcohol, let it dry. Now prick. In one prick, from one percutaneous puncture site, you have to take 2 bottles. Means that if you are sending one set of blood culture, it doesn't mean that you puncture one side and another, one bottle from one side, another bottle from another side. Never. One set means you are taking one aerobic, one anaerobic, and this is from the one single percutaneous puncture site. That is important. From one percutaneous puncture, you are taking 2 bottles. One set, that is 2 bottles from the same site. One for aerobic, one for anaerobic, one set complete. If you are taking second set will be from another hand, one aerobic and one anaerobic. So there will be, if you are taking 2 sets, there will be 2 percutaneous puncture sites from 2 different hands. That is very important. If you are sending only one from one hand, one puncture site, just one puncture, take the blood and apply it to 2. That is very, very important. It is not that you take one bottle from there or one from another hand. That is not one set. One set is one puncture site, one hand, take 2 bottles. If you are taking 2 sets, then from one hand, suppose you are taking from left hand, then again remove the blood, applying the alcohol, betadine, then alcohol, then puncture, then take out the blood, putting it into the 2 bottles, send it out from another hand, right hand, same alcohol, betadine, then alcohol, then remove the blood and put into 2 bottles and send it for culture. If you are going to take 3 sets, then you can take first here, then second here, then third from this hand or from other visible vein, other accessible vein where you have. If you are going to take from the central line, then if your patient has central line, then one will be obviously from central line and another from the peripheral percutaneous puncture. If you are taking only 2 sets, then also one from the central line and another from the peripheral percutaneous puncture. This will help to differentiate the catheter-related bloodstream infection as well. Okay, so how to take it is very important. What is actually one set? that is also important. And the volume, the more the volume you will give, the more the sensitivity will be for the blood culture. In case of children, in case of the child, in case of the babies, if betadine is not applicable, then in that case you apply thrice alcohol. In adult, what you do? Alcohol one, then alcohol, then betadine, then alcohol. So it was, or some patient you is not allergic, then alcohol, and betadine is enough. But in case of children, in case of infant, if betadine is not applicable or you think it may be allergy, then you swap with alcohol, second swap with alcohol, and third swap with alcohol. This will help to clear all the micro, that is normal flora present over the skin. I hope you have understood the procedure of blood culture and you educate your nurse, because this is important. The blood culture volume is important. If you are going to get your organism, you will have the DST, drug sensitivity report, and you will able to cure the patient very efficiently. If you don't have a culture, empirical therapy will lead to nowhere. Another point of this important point is the sensitivity, the sterilization of the area that you are taking the blood culture. You should educate very well to your nurses, because if you are growing the flora that is present on the skin, then patient is suffering. He is dying from another organism, and you are growing in culture of your normal flora. Then that culture positive report is actually very harmful to the patient. You will be confused. You will be treating the saying that okay, this organism is responsible, actually another organism is killing the patient, and you are just targeting the skin organism, which is very bad for the patient. So this two message is very important, and I hope you will convey to your sisters, your other friend, and make it use in your daily life.